One of the biggest problems we face when we are trying to follow up with parents who've got a child diagnosed with newborn screening through Fabry disease is, when do we start therapy and what health problems are my children going to have and when are they going to have those health problems? So we developed the MOPPet study to try to answer those questions. We've taken kids who are diagnosed through family history or those who've been diagnosed through newborn screening for Fabry disease. They do it in Missouri and Illinois and New York State at this time, and try to find a way to systematically follow them over time and answer some of those questions. And we answer them through asking parents in real time what's different about their child's development and what symptoms they may be having, and also looking at biomarkers, ones that we don't do usually, urine tests. We don't do any blood tests. And hopefully we are currently halfway enrolled in our baseline cohort, and over time we're going to follow them for 4 years and hopefully find some real answers so that parents have a better understanding of what's happening when they get diagnosed in the newborn period with Fabry disease. We've been trying to learn from the state of Missouri a little bit more about the incidence of Fabry disease. Right now they're having 1 in 4,000 babies who have low enzyme levels for alpha-galactosidase A, which is what we measure for Fabry disease in newborn screening. When we do molecular testing, the number goes down a little bit, and there's a common variant that we see up in Missouri that's accounting for a lot of those patients who are affected. And we don't know the impact it's going to have on their health. We know that some people with what's called the A143T mutation have classic symptoms, so more severely affected by Fabry disease. But we've got other family members who are completely normal and go on to live a normal, healthy life with that change. So part of the Project MOPPet is trying to figure out, do biomarkers support that a baby is going to be more or less affected when they have this change in the gene? But there's a lot more research that needs to happen into A143T, and I'm hoping over the 4 years of this study, that information by the time we get to the end will be there to connect with our data and our biomarkers to really give us a better answer for newborn screening.